With school back underway, Brian, right now in the fall, and some students in school, some not, the whole question of the impact on all this on children is why we're pleased to have right now Dr. Teresa Nguyen. She is a pediatrician and assistant chair of the Department of Pediatrics at GBMC Healthcare. Good morning, Dr. Nguyen.
Morning, doctor.
Good morning. How are you?
Doing great. Let me ask you, Doctor, as it relates to now, we've had socially distancing and remote learning since March now for many children. What has been the impact on this, and both on the parents and children as well?
I think one of the biggest impacts has been the emotional, mental impact on the children and their parents. There's a lack of socialization for the children, and for the parents, it's the overwhelmingness of having to coach their children through school and kind of be the teacher's assistant while they're continuing their job, if they're lucky enough to continue their jobs at home. And then if they're not, that means some of the parents now are sending their children to daycare centers while the children learn online and the parents are working live at their jobs. So that's one of the biggest, the mental health aspect of COVID. The other part is the physical. I think there may be a second epidemic of obesity coming from our epidemic. Children are just not as active when they are sitting in front of the computer for 3 to 5 hours a day, and there's not always gym programs for children to be doing things. At school, there's gym. When you have distance learning, virtual learning, there's no gym, and many families are still cautious about participating in outdoor sports activities. Some aren't, but many still are. So children are spending way too much time indoors and not enough time of it, at least 1 hour of physical activity a day.
We know that the death rate is exponentially lower for children when it comes to COVID. I'm curious, have you had a patient who has had COVID? What is it like for kids who actually have tested positive or have contracted coronavirus?
So I've had quite a few patients who have been COVID positive. The good news is most of my children have done well. The majority of the kids will have mild symptoms. I did have one teenager, and, they're really living the facts that are being published scientifically right now, is that the younger children under 10 tend to have mild disease, maybe symptomatic for 1 or 2 days, maybe not very symptomatic. But the older adolescents are the ones who have more symptoms, and that's what the studies are finding also. So I had one young lady early on who started like maybe she had strep because she had a sore throat, and then she progressed to having cough and body aches and then fever. She took about 3 weeks with the illness. She had fevers. She did not have pneumonia, but it took a respiratory toll on her, and she was really not back into her full self for at least 3 to 4 weeks after she was infected with COVID. And this was a 17-year-old.
You're listening to our fourth Townhall special, the coronavirus, in partnership with GBMC Healthcare. Dr. Teresa Nguyen, pediatrician and assistant chair of the Department of Pediatrics, is on board with us. And when it comes to, we're all being urged right now, adults and children to get our flu shots. Dr. Nguyen, what is a good time to get children a flu shot right about now?
Right now.
Okay.
Flu shots are available in your doctor's office, at retail pharmacies, and we've been doing it in our practice for the last month. It takes 2 to 4 weeks for your body to build immunity to the flu once you've received the vaccine. And so if we're predicting that flu usually hits somewhere in October, November, and we are now in October, now is the time to get your flu vaccine for your children and yourself.
Can you get a flu shot for a kid anywhere, or do you have to go specifically to your pediatrician or an urgent care?
So the retail clinics, depending on the retail clinics and the urgent care centers, some of those may not do children under 5 years of age. So younger children, for sure, infants and toddlers should definitely go to their pediatrician's office. Older children, and don't quote me on this, but I'm the youngest age group that I've seen in retail pharmacies is 5 years old that they're willing to give flu vaccines to.
To your point about the kids that you have seen who have had it, and you mentioned, hey, 10 years old, the symptoms haven't been that bad. Do you think that kids should be able to go to school in person, especially at that elementary school level?
Absolutely. I am emphatic about that. We know that the younger children under 10 are less likely to get infected. They have milder disease if they do. and they are less likely. It's not saying that they don't, but they are less likely to be the vectors of disease, unlike in influenza. And they are also the children who cannot learn online virtually. It is really difficult for preschoolers and elementary school children to engage with a teacher virtually. Their parents have to be involved, and this is what I was talking about earlier. Parents are very distressed being the teacher's helper while doing their job. So their children are in school for at least 5 to 6 hours a day, quite a few hours on video, and the children need help getting onto the computer, help staying on and then if there's any technical difficulties, the parents have to be right there and available. So the most benefit would be to get the elementary age school children back into the classroom safely, as long as the infection rates remain low and we have proper social distancing and masking and hand washing. Elementary school age children should be back in the live classroom in some format.
Dr. Teresa Nguyen, pediatrician, I know your primary thing is dealing with children and kids, but the parents and teachers are listening to this as well, and there's this fear out there, even with everything you just said. What is your message to them, though? I mean, if you were talking directly to teachers and parents, what would you say?
I would say just as what I'm saying, as long as the children are masked and there's proper social distancing, and their teachers are masked and proper social distancing, and that the children and the teachers who are in the classroom are not at high medical risk, that they have some underlying medical conditions that would put them at high risk if they were to get COVID. Now, I want to point out that daycare centers have been open throughout COVID since March. Daycare centers for emergency workers, children. There have been no massive outbreaks at daycare centers. So we have small data already for the last 7 months that this is doable in even a very young age group. The young kids are actually able to mask, and proper safety precautions are able to be carried out in the daycare centers. So that gives me a lot of hope that older elementary school age children who are very prone to wanting to please and follow directions, they will keep their masks on, adhere to hand washing and social distancing so that they can be safely back in the classroom with teachers and classmates.
All right. As we get into the winter months, obviously you worry about the flu, you worry about COVID still in the background, but kids also get colds, they get ear infections. So what should a parent do if their kid has, a sore throat or a headache or, a stuffy nose or a cough that may just be a cold? What's the approach for parents from here on out?
I think if your child has any symptoms where in the past we would have said, oh, it sounds like a cold, it's viral, it's mild symptoms, you can still go to school until you have fevers. Now we're going to be very cautious. If you have any symptoms, cough, runny nose, fever, you need to err on the side of safety and keep your children home. And if you have any doubt, of course, please reach out to your pediatrician. And I'm encountering that right now on a daily basis for my children who are in daycare settings or in the few private schools that have reopened in some kind of hybrid models. Parents have called and asked about a runny nose or a cough. And I really advise parents that this year, very different from other years, we're going to be cautious. If there's any kind of symptom outside of the normal, absolutely healthy, you should keep your child home until the symptoms have cleared up.
Should we get them a test, or is that not necessary?
No, not unless I think they should contact their pediatrician and, really review the full symptoms. So if it sounds like it may be COVID, if there's the cough, the runny nose with the fever, depending on what the specifics are, then perhaps they would need a COVID test. I don't think that every child with cough, runny nose needs a COVID test.
Assistant Chair of the Department of Pediatrics at GBMC Healthcare and pediatrician, Dr. Teresa Nguyen. I want to thank you very much for your time on our fourth Town Hall special of the coronavirus.
Great to have you on, Doctor. Thank you.
Great. Thank you.